Welcome back to Interpreter Training Preparation. This is part 3 of our series. And again, if you haven't watched the previous videos, please go back and watch those. But this video will be giving a scenario of medical nature. We'll be talking about diabetes. In the United States, that's a particular disease that has been increasing and that we see a lot of need for interpretation for. So watch this scenario, and again, listen for the words and phrases that may be unfamiliar to you. Figure out what words and phrases you would say to interpret that. Then go back again and watch the video and simultaneously interpret the video, and so you can practice your skills that way.
I am a certified diabetes educator, and one of the roles that I fulfill is assisting patients as they move from injection insulin therapy to continuous insulin therapy administered through an insulin pump. One of the first things I do with patients is I suggest different types of pumps they may be interested with. In my practice, we use 3 different types of pumps. One of the pumps we use is a Medtronic insulin pump. Another that we use is a tandem insulin pump. Both of these pumps are similar in the fact that they contain an insulin cartridge that goes into the pump, connected to tubing that has a needle on the end that's inserted into the patient so that insulin passes from the pump to the patient through a tubing. The third type of pump that we use is an Insulet pump. It's called an Omnipod. The Omnipod is unique in that a pod of insulin is filled, placed on the patient's body, their abdomen, the back of their arm, and then it's controlled with a separate controller that uses a Bluetooth discussion to tell the pod how much insulin to give. There's no tubing attached. So all 3 of these pumps are very effective. It comes down to patient preference, which type of pump they want to use. All 3 of the pumps work by containing one type of insulin in their pump and then distributing that insulin to the patient in a basal bolus type therapy. Let me explain to you the difference between basal and bolus therapy. Basal therapy is insulin that is continually infused into the body. This is the insulin that the patient needs whether or not they're eating a bite of food. The basal insulin is simply meeting the metabolic needs of the patient. People who have type 1 diabetes must have continual insulin given to them or they become very ill very quickly. So basal insulin is given. Then bolus insulin is the pulse of insulin that's given for the carbohydrates the patient eats or for a high blood sugar. It's all the same insulin, but the way the insulin is distributed through the pump makes a difference whether it's basal or bolus. So for example, if a patient on injection therapy is taking 24 units of basal insulin a day, then we would say, since there's 24 hours in a day, 24 hours divided into 24 units means that the patient needs 1 unit of basal insulin an hour. What the educator would do is help set up the pumps so that 1 unit of insulin an hour is distributed slowly, like a slow soaker hose, throughout the day. That way, the patient gets their basal insulin much like a person without diabetes in a continuous manner. Then, when a patient eats or checks his blood sugar and finds it high and they need a pulse of insulin, we set the pump up so that the pump knows how much insulin to give per gram of carbohydrate and per unit of blood glucose above a target. So the patient simply needs to place in their pump the grams of carbohydrate they're eating, what their blood sugar is, and give themselves a pulse of insulin. With basal and bolus insulin therapy, a patient will maintain their blood glucose control with the assistance of their educator.